Hello again, this is Dr. Rob Lindsay with Thyroid Treatment Success Secret number 14. This is about vitamin D. You've always seemed to hear in the news that there's some new vitamin to consider or new deficiency to consider, but when it comes to Hashimoto's thyroiditis or autoimmune thyroid, it's very important that patients are taking vitamin D to help their immune system. Modern diets are lacking in vitamin D-rich foods. What are vitamin D-rich foods? Liver. To be honest with you, I can't stand liver, but it's a good source of vitamin D. Organ meats, lard, many forms of seafood, butter, and egg yolks. Remember what I said about eating eggs for breakfast and how important it is if your blood sugar levels are too low. Sunlight is another important factor and source of vitamin D, but you should never take vitamin D without having your vitamin D levels tested, specifically 25 OHD and 125 OHD. Most MDs will only test 25 OHD, but it's very important to have both levels tested. This way you're eliminating the guesswork. You could be low in vitamin D or on the low side of normal. Either finding would constitute a different recommended dosage. Why is vitamin D so important? Well, vitamin D deficiency is associated with many autoimmune conditions, including Hashimoto's thyroiditis. Frankly, autoimmune rates have been skyrocketing in the past 20 years, which correlates with decreased levels of vitamin D in the general population. Adequate vitamin D levels help to keep the immune system in balance so it doesn't swing out of control into an autoimmune disease. When it comes to Hashimoto's thyroiditis, the problem with vitamin D deficiencies are made worse by genetics. There are studies that show that more than 90% of the people with an autoimmune thyroid or Hashimoto's have a genetic defect affecting their ability to process vitamin D. Therefore, many people, especially these people, need higher amounts of vitamin D to maintain health, even if their blood tests show sufficient vitamin D. In many cases, patients will come into my office and their vitamin D levels will be on the low side of normal, and their MD has told them, "You're fine, and there's nothing wrong with you," when actually, if you're on the low side of normal, you need to be supplementing with vitamin D. I recommend that all my patients with any thyroid condition or any autoimmune condition take extra vitamin D. Thank you for listening today. Look forward to the next success secret on the next video. And again, our number 952-949-0676.